Hi, my name is Donnie Young with Jackson County Emergency Services. Jackson County is beginning a new system of patient care delivery for the ST elevation myocardial infarction, also known as the STEMI. The STEMI is the deadliest form of a heart attack. Our intent here at Jackson County is to deliver the STEMI patient to a PCI facility, or also known as percutaneous coronary intervention facility, in less than 90 minutes from the time of dispatch to the time of the vessel opening. Our system is unique in the fact that we have 3 PCI facilities within 15 to 30 miles of most of our citizens. Jackson County will prepare the patient for mobilization into the cardiac catheterization lab by utilizing the specially prepared STEMI box. The boxes contain equipment supplied by the hospitals that will adapt quickly to the in-hospital environment, thereby minimizing delays in switching out equipment or repeating care. And this will occur in conjunction with typical ACS care and early transmission of the 12-lead ECG. We theorize a potential 5 to 10 minute decrease in time in the overall spectrum of care by beginning the steps to bypass the emergency department. These simple care parameters may not appear to be time-consuming, but in reality, they take a few people to accomplish and a few extra minutes to perform once the patient arrives in the hospital. I would now like to take a few minutes to go over the STEMI boxes and their contents. Each box will contain specific equipment supplied by the hospitals that will adapt quickly to their in-hospital environment. All 3 boxes are basically the same in contents except for just a few subtle differences. Med units will be stocked with 3 labeled STEMI boxes for each PCI facility. I'm now going to go over the contents that are the same in all 3 STEMI boxes and that we currently use on all of our med units. Each box will contain a Select 3 drip set that we've all used for years, also the needleless extension sets. Also, each box will contain 2 saline flushes. And then we'll have a selection of IV catheters of different size gauges in the Insight style and the Intracan, so that you can use whichever one you feel most comfortable with. Also, there will be a patient care checklist to document any meds, treatments that you have done. And then also there's an inventory check sheet. And then if you have enough time, we would like for you to place the patient in a hospital gown so they'll be ready when they roll into the cath lab. Then also there'll be a plastic bag to place all the patient's personal belongings in, whether it's clothing, jewelry, wallet, etc. And then, if you will, just write their name on the front of the bag and keep the bag with them at all times. Okay, we've talked about the contents that are the same in each box. Now we're going to talk about the differences in each STEMI box. Northeast Georgia will have 1 additional IV drip set that they would like for us to start on our patient in our second IV site. These work exactly like our Select 3 drip sets, nothing different. Also, Athens Regional has another specific IV tubing that is used with their IV pumps in their hospitals. So this needs to be their primary drip set. And also, they will supply us with defib pads that'll be in the boxes also. The only difference with St. Mary's is they're going to have some vacuum tubes for us to collect blood. In conclusion, the additional STEMI preparation will be performed in conjunction with typical ACS care, and to request orders to administer medications to further prepare the patient for cath lab arrival. Transmission of the 12-lead EKG should be done as soon as possible, preferably before patient transport. Adding a few simple steps in the care of the STEMI patient should result in a 5 to 10 minute decrease in the overall time from dispatch to balloon. The ultimate goal is to have the patient to the facility in the cath lab within 90 minutes from dispatch. Paramedics must use sound judgment in choosing the facility deemed capable of meeting the overall patient treatment's goals within this time period. Destination decision may not always be the closest facility or the closest PCI facility. The overall dispatch to balloon time should be the ultimate factor for making the decisions, along with determination from the patient's cardiologist or facility preference.